It's here. The coronavirus is in Wisconsin. I'm Adrienne Pedersen. Today on Up Front, state health officials report the first case of coronavirus in Madison. Next, is worry about the virus warranted? And what can you do to protect yourself and your family? Plus, cracking down on reckless driving, the new plan to stiffen penalties. And caucus chaos. Reporter Matt Smith is back from Iowa, and we'll talk about whether the state could lose its first in the nation status.
Taking on the issues important to Wisconsin. This is Up Front with your host, Adrienne Pedersen.
Thank you for joining us. The fast-spreading novel coronavirus has prompted an international response, and now doctors have identified the first case here in Wisconsin.
The patient did not require hospitalization. They are currently in home isolation.
The patient is a Madison area resident who had recently traveled to China with family members. Health officials say the risk of spread to the general public is low, but they are attempting to monitor everyone who came into contact with that person. People do have a lot of questions about coronavirus, and we're trying to help answer at least some of them today. So we're talking with Dr. Mary Beth Graham, who is a medical director of infection prevention and control at Froedtert Hospital and the Medical College of Wisconsin. Thank you for your time on this important topic.
Thank you for inviting me.
I guess the first question is, how concerned do we have to be about this?
I always temper this by saying I think that knowledge is important. I think that being aware is very important because it will make people think about, okay, should I have this travel, like the CDC has said, non-essential travel to China should not happen. I think those things are important so that we're aware, but in terms of risk that we have here now today, there's much higher risk of influenza and other respiratory viruses like respiratory syncytial virus in our area than we actually have from this novel coronavirus. I think the other thing that's important to know is that we need to raise some awareness because we've had some very scared patients at our hospital. There are coronaviruses that circulate all the time. They cause the common cold. When we screen people at the hospital when they come in with a respiratory infection, we'll swab their nose, get the test back. We've had a few tests positive for the normal coronaviruses that circulate in this area that cause the common cold. And there's a huge amount of fear. Oh my goodness. How did I get coronavirus? It is not the same thing as the 2019 novel coronavirus. The only way right now that we can screen for the novel coronavirus is through the CDC, although the CDC actually and the FDA has now allowed state labs to do it. And from what I've told, the state of Wisconsin will be able to screen for novel coronavirus starting next week.
Well, that's some big news there, that they'll be screening for that coming up. And
it'll cut down on the amount of time, because right now the time between you send in the specimens to you're getting back the information, it was anywhere from 7 to 10 days.
Well, and I understand too that you might not even be showing symptoms right away when you have coronavirus.
That's a huge, that's a huge unknown right now. So even if you look at the CDC, the majority of the patients, they do believe are having some type of symptom, either fever or upper respiratory symptom at the time that they are considered contagious or presenting. So there's been a lot on the internet saying that people can transmit this before they're symptomatic. We need more information. We honestly don't know at this time, but from the reports I've read, the majority of patients who are identified do have symptoms. They're not totally asymptomatic. So if you've come back from China within the last 14 days and you have a new respiratory symptom, new cough, new fever, new sniffles, shortness of breath, anything, those individuals are considered persons under investigation who should be screened to look for novel coronavirus.
And when it comes to protecting yourself and your family, I've heard two very different things in terms of whether you should buy a mask or not, because now there are shortages of these masks. Medical professionals obviously need them. Does a mask help you? What's your opinion on that?
So I think the thing that a mask does the most, if people actually think about this, how many times a day do you touch a surface and then touch your face?
A lot.
A lot. And we do it unconsciously. So one of the best things about the mask, because the way that these are spread, respiratory viruses, influenza, coronaviruses are spread via what we call respiratory droplets. So if I were to cough or to sneeze, somebody that's within about 3 to 6 feet of me could inhale those respiratory droplets, but then they fall to the ground or they fall to a surface. They're not airborne, which is going to go across a gymnasium for somebody. They're a different type of droplet. But when they fall to a surface, the virus can still exist on the surface. I don't know exactly how long they will live on a surface. There are some viruses that as soon as the area dries out, the virus can't be transmitted. There are others that on a drier surface could still be transmitted, so that's an unknown to me right now. But if it were here, I pick it up and then I touch my nose or my mouth. That's how I basically transmit it. But I think actually the best thing it does, it keeps you from touching.
How easy is this to spread this virus? I mean, you have people who are quarantined on planes, who are the person in Madison staying inside their house.
When this first started, they were saying if you're asymptomatic coming back from China, yeah, you should check your temperature, but you don't need to self-isolate. Now people have started to say, well, maybe you should do this. It's evolving. Every single day the story changes a little bit. Again, the way I say about the self-isolation for somebody is if you come back and you've got symptoms, definitely would want to self-isolate, contact your healthcare provider. Don't go in, if it's mild symptoms, just don't run into the hospital or to the ER, et cetera. If they're mild symptoms, contact your healthcare professionals so that it can be a very controlled situation where then the healthcare provider can arrange for you to come in, to be tested, and then to go back home.
How ready is the medical community in Wisconsin for the coronavirus, you think?
I think that most medical professionals that I know are reading and hearing about this up to date. They know the basic recommendations from CDC. At our institution, our Infection Prevention and Control Committee has sent out very distinct stepwise guidelines on what needs to be done, if somebody comes in and if we need to evaluate them. So I have a lot of faith in my colleagues. So I would say I think that we would be well, prepared.
And just one more thing I really want to clear up for people is if you haven't been to China and you're thinking, could this still affect me if I go on a plane or if I go out in public or if I go to a restaurant? I think that's maybe a big concern because most people in our area are not visiting China.
Correct.
How concerned do everyday people need to be about this?
Not.
Okay.
Not. I mean, it's the travel or known exposure to somebody with a diagnosed case.
Thank you, Doctor. We appreciate your time.
Thank you.
Next, bad news for Democrats. Turmoil at the Convention Host Committee, and their first national nominating contest was a disaster. We'll look at what this could mean for Iowa. That's coming up next. And later, the new attempt to crack down on reckless driving.